Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1. Questions 1 to 12. You hear a gastroenterologist talking to a patient called Mr. Virat. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mr. Virat. I'm Dr. Helen, the gastroenterologist. I understand you're experiencing some troubling symptoms?
Yes, good morning, Dr. Helen. I'm feeling terrible, honestly. I've been having constant nausea, and I've barely eaten in 2 days.
I'm sorry to hear that. Let's take a closer look at what's been going on. Can you tell me a bit more about when your symptoms started?
Well, I felt fine until the day before yesterday. We went out for dinner that night, and just a few hours after eating I started feeling queasy. Since then, it's only gotten worse.
I see. Was there anything specific you ate that seemed off or unusual?
Not really, but I did have a seafood salad. It tasted fine, but I remember it seemed slightly warmer than usual, almost like it hadn't been kept chilled properly.
Thank you, that's helpful. Based on what you've described, it's possible this could be a case of food poisoning. Likely from something in that salad. It can happen if food isn't stored or prepared correctly, particularly with seafood.
Oh no. I thought food poisoning would just cause a bit of an upset stomach. I didn't expect it to be this intense.
Yes, it can range from mild to severe. It sounds like your body is reacting quite strongly. Aside from nausea, have you had any other symptoms like vomiting, fever, or stomach cramps?
Yes, I've had all of that. I threw up several times yesterday and had some intense stomach pain. I also felt feverish last night, though I didn't take my temperature.
Thank you for sharing that. Fever, vomiting, and cramps are common signs of food poisoning, especially if it involves bacteria like Salmonella or E. coli, which are sometimes found in improperly stored or prepared seafood.
Is that serious? Should I be worried?
Most cases are manageable, but they can sometimes become serious if they lead to dehydration or if the bacteria are particularly strong. From what you've described, it sounds like your symptoms could be managed with supportive care, but I'll want to assess a few more things. Are you still experiencing diarrhea or any blood in your stools?
Yes, I've had some diarrhea, though it's been less frequent today. No blood, thankfully.
That's good to know. Diarrhea is common in food poisoning and can help flush the infection out of your system. However, it can lead to dehydration, especially if it continues without enough fluid replacement. Have you been able to drink any water or fluids?
I've been trying, but even small sips make me feel nauseous again. I'm worried about drinking too much at once.
That's understandable. Taking small sips frequently is actually a good approach. You could also try rehydration solutions which contain electrolytes to help balance the minerals your body loses during vomiting and diarrhea.
I'll try that. How long do these symptoms usually last?
Typically, most cases of bacterial food poisoning resolve within a few days, though mild nausea and fatigue can linger. If symptoms last longer than a week or worsen significantly, it would be wise to come back. Severe or persistent cases sometimes require antibiotics, but we generally try to let the body handle it naturally first.
So, no antibiotics right now?
Correct. Antibiotics are only used for specific types of bacterial infections, and overuse can sometimes lead to resistance or worsen symptoms. For now, hydration and rest are the primary treatments.
That makes sense. Is there anything I can do to help with the nausea?
Absolutely. You could try consuming ginger or mint tea, which can help soothe nausea. Avoid fatty, spicy, or rich foods for now. When you feel ready to eat, start with bland, easy-to-digest options like toast, rice, or bananas.
Okay, I'll try that. Is there any way to know for sure that it was food poisoning from the seafood?
We can't confirm without specific tests, but based on the timing and your symptoms, it's a strong possibility. Food poisoning from seafood, especially if it's not properly chilled, can often cause these kinds of symptoms. If the symptoms continue beyond a typical duration or worsen, we might consider stool tests to identify the specific bacteria or virus.
Got it. So just to be clear, I should focus on hydration, rest, and eat bland foods. And come back if it doesn't get better.
That's exactly right. And remember, small, frequent sips of water or an electrolyte drink are crucial. Avoid alcohol, caffeine, and sugary drinks, as they can further dehydrate you.
Thanks, Dr. Helen. I was worried it might be something more serious. It's good to know it's manageable.
You're very welcome, Mr. Virat. If anything changes or you feel worse, don't hesitate to reach out. We'll be here to help.
Thank you so much. I feel a lot better knowing what to do.
Extract 2, questions 13 to 24. You hear a doctor talking to a patient called Miss Ginny. For questions, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Miss Ginny. It's nice to see you today. How can I assist you?
Good morning, doctor. Thank you for seeing me. I'm here because my migraines have been getting worse over the past few months. I used to get them now and then, but lately, they've been happening more often and seem a lot more intense.
I understand. Migraines can be quite challenging to manage, especially when they start interfering with daily life. Can you describe your symptoms during these episodes?
Sure. When I get a migraine, I feel a pounding pain, usually on one side of my head. It's bad enough that I feel nauseous, and sometimes I end up vomiting. I become so sensitive to light and sound that I need to lie down in a dark, quiet room.
That sounds quite severe. Have you noticed any particular triggers or patterns that seem to bring on these migraines?
I think stress is a big one. My job can be intense. I'm in marketing, so there's always a lot going on. I've also noticed that certain foods like chocolate and red wine can make things worse. And if I don't get enough sleep or go too long without eating, that can sometimes trigger a migraine too.
Those are common migraine triggers, and it sounds like you're already aware of a few potential lifestyle factors. How long do your migraines typically last?
They usually last about a day, sometimes a bit longer. There have been a few that stuck around for almost 3 days. When that happens, I struggle to keep up with work and take care of things at home.
I can imagine that would be incredibly disruptive. I see from your records that you haven't tried prescription medications specifically for migraines. Are you using anything over the counter for pain relief?
I've been taking ibuprofen, but it doesn't seem to work much anymore. It used to help, but now it barely takes the edge off. I haven't tried anything else yet.
Given the frequency and severity of your symptoms, we have a few options to consider. Migraines can sometimes be managed with lifestyle modifications and preventive strategies. But since they're interfering with your daily life, medication might be a good option to explore.
Could medication help prevent the migraines from happening? I'd be interested if it could reduce how often I get them.
Absolutely. There are preventive medications that can help reduce both the frequency and intensity of migraines. We also have acute medications, which are taken at the onset of symptoms to help manage the pain and related symptoms. Some options include triptans, which are commonly prescribed to relieve migraines, and certain preventive treatments like beta blockers, antidepressants, or anti-seizure medications.
That sounds hopeful. Are there side effects I should be aware of?
Some of these medications can have side effects, depending on the type. Triptans, for instance, are usually well tolerated, but can cause drowsiness or dizziness in some people. Preventive treatments vary, but we would start with a low dose and adjust based on how you respond. We'll monitor closely to make sure it's working for you.
I appreciate that. I'm willing to try a few options if it might help me get these under control.
That's a sensible approach. I also recommend keeping a migraine diary. It can help us track patterns, triggers, and how well the treatments are working. You could note your diet, sleep habits, stress levels, and anything unusual you notice.
That makes sense. I think it might even help me see patterns I hadn't realized before.
Great. In addition, we might consider a few lifestyle adjustments. Ensuring regular sleep, eating balanced meals, and staying hydrated can make a difference. Techniques like mindfulness or relaxation exercises can help manage stress, which may also reduce the frequency of migraines.
I've heard a little about mindfulness, but I've never tried it. I'm open to giving it a go if it might help.
Studies show that mindfulness, meditation, and even gentle exercises like yoga can be helpful. These practices reduce stress levels and might help prevent migraines over time. Let's set up a plan where we combine lifestyle adjustments, medication, and a tracking approach. We'll evaluate after a few months to see how well this is working for you.
That sounds like a solid plan. Thank you, Doctor. I feel better knowing there are steps we can take to manage this.
You're very welcome, Ginny. Migraines can be tough, but with the right approach, many patients see significant improvement. We'll work through this together and adjust as we go to find what's most effective for you.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear 2 maternity care supervisors discussing the importance of cultural sensitivity in maternity services. Now read the question.
It seems like some of our staff members are struggling to provide culturally sensitive care, especially when a patient's beliefs or traditions don't align with medical recommendations.
That's definitely a challenge. Have we provided staff with any resources on this?
We've shared online guidelines and even held 2 training sessions, but it doesn't seem to be enough for everyone to feel confident in these situations. I think we should address this in the maternity staff meeting next week.
Is that scheduled for Friday morning? Will everyone be able to attend?
Yes, it's on the calendar for all staff. If anyone can't make it, we can arrange to speak with them individually to make sure they're comfortable with these practices.
Now look at question 26. You hear members of a hospital ethics committee discussing ethical considerations in emerging medical technologies. Now read the question.
Diagnostics, CRISPR gene editing, and brain-computer interfaces, we're entering complex ethical territory. For instance, in diagnostics, AI tools offer powerful insights, but we need strict protocols to ensure they align with patient safety. We've been awaiting approval for guidelines on AI use, but there's been a delay in the legal review process. This means we're currently unable to implement the tools fully, as we're waiting for legal clearance.
Now look at question 27. You'll hear a dietitian discussing dietary adjustments with a patient. Now read the question.
So, Mr. Taylor, you've been dealing with persistent digestive discomfort, correct?
Yes, it's been bothering me for weeks now. I often feel bloated and constipated, and it's quite uncomfortable.
That sounds challenging. To help with your symptoms, it's essential to make some dietary changes. Have you tried incorporating more fiber into your diet?
Not really. I didn't think it would make much difference.
It can be very beneficial. Increasing your fiber intake can help ease constipation. Also, if you continue to have issues, a gentle laxative might be necessary to provide some relief. I'd recommend starting with whole grains, fruits, and vegetables to see how your body responds.
Okay, that makes sense.
Great. Let's focus on making those changes and see how you feel over the next couple of weeks.
Now look at question 28. You hear a trainee nurse discussing with a mentor. Now read the question.
Hello Maria, I have a case I'd like to discuss with you.
Of course. Tell me about it.
I'm seeing a 4-year-old girl in the pediatric outpatient clinic. She's been having recurrent asthma attacks over the last few months, and her parents brought her in today because she's been experiencing shortness of breath almost daily. They mentioned that she's been waking up at night due to coughing and wheezing, and it's affecting her activity levels. I've done a physical exam, and while her oxygen levels are stable, her breathing is clearly labored, especially during exertion.
What are you thinking as a working differential diagnosis for her current symptoms?
I'm considering a few possibilities, such as poor asthma control due to inadequate medication or technique, environmental triggers at home, or even an underlying respiratory infection. There might also be concerns about the family's understanding of her asthma management plan.
Good thoughts. So, what steps do you plan to take next? Now look at question 29. You hear a training session on the effect of stress and anxiety. Now read the question.
Today, we're going to explore how stress and anxiety can affect an athlete's performance and overall mental wellness, particularly in high-stakes competition environments. Mental health professionals play a significant role in supporting athletes and their coaches by conducting thorough mental health assessments and providing strategies for managing stress before, during, and after competitions. We'll begin with a case study focusing on an athlete named Sarah, who recently faced a series of high-pressure events. She noticed increased anxiety and difficulty focusing during her training sessions leading up to competitions. After evaluating her needs, we determined that implementing mindfulness practices and improving her sleep hygiene could significantly improve her ability to manage stress. Additionally, regular sessions with a sports psychologist were recommended to develop coping strategies for long-term mental resilience.
Now look at question 30. You hear a researcher talking to a patient. Now read the question.
Treatment, Mrs. Lang?
A bit tired, honestly. But I think it's working because I don't have as much bloating as before, like you said might happen.
That's normal. Some people feel a bit fatigued initially as their system adjusts. But overall, it's a good sign. We're targeting your microbiome to help balance your gut health. You're really on the forefront of new treatment approaches here.
Oh, that's exciting. I'd read a bit about the microbiome before, but it's fascinating how quickly you can feel a difference with it. It's still amazing to think how much it can influence other things, like my immune system.
Absolutely. As your microbiome becomes more balanced, you might see benefits beyond digestion, potentially even for your immune response. Just be sure to stick to the plan. And let's check in next month.
Next month? After I started, I expected to feel better in a week or two. But I guess patience is key with these things.
Exactly. When it comes to microbiome health, the body often takes time to respond.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear a doctor giving a detailed presentation on the use of MRI in diagnosing spinal cord injuries in trauma patients. You now have 90 seconds to read questions.
Good afternoon, everyone, and welcome to today's training on the use of MRI in diagnosing spinal cord injuries in trauma patients. This session is geared towards trainee trauma physicians who often encounter patients with spinal injuries in the emergency department. Since many of you may need to make quick decisions on ordering the appropriate imaging, we'll discuss the role of MRI in diagnosing spinal cord injuries, especially when other imaging modalities, like X-rays or CT scans, may not provide enough detail. When a trauma patient presents with a suspected spinal injury, the initial imaging approach often begins with X-rays or CT scans due to their speed and accessibility. However, MRI is critical for assessing more complex injuries. MRI provides a high level of detail on soft tissues, such as the spinal cord itself, the surrounding discs, and ligaments. Therefore, it is particularly useful for diagnosing conditions like spinal cord compression, disc herniation, or vertebral fractures that may not be immediately visible on other imaging forms. Now, let's talk about the first step in the MRI evaluation process: assessing spinal cord compression. Spinal cord compression can result from bone fragments, a herniated disc, or a mass pressing against the spinal cord. Symptoms include weakness, numbness, and even loss of bladder or bowel control, depending on the severity and location of the compression. MRI can help visualize the spinal cord and surrounding tissues, making it easier to determine the extent and exact location of compression. If compression is found, immediate intervention might be necessary to prevent further damage to the spinal cord. The second area we assess is for disc herniation. Herniated discs occur when the soft inner material of a spinal disc pushes out through the tougher outer layer and may press on nearby nerves. This can cause pain, numbness, or weakness along the affected nerve pathways. When a herniated disc is suspected, MRI helps to confirm the diagnosis and identify which disc is herniated and to what extent. This information is crucial for deciding on the appropriate treatment, which could range from physical therapy and pain management to surgery. Our third focus is on detecting vertebral fractures, particularly in cases where the fracture might have a significant impact on the spinal cord. MRI is highly effective at revealing fractures that may not be detected on X-rays or CT scans, especially if the fracture is subtle or involves soft tissue damage around the vertebrae. It's essential to identify these fractures accurately, as some may require stabilization procedures to prevent further damage to the spinal cord. The next step is examining for signs of hematoma, which is a collection of blood in or around the spinal cord. A spinal hematoma can result from trauma and may cause compression of the spinal cord or nerves. Symptoms often include sudden and severe back pain, as well as neurological changes if the hematoma compresses the spinal cord. Detecting a hematoma early is critical, as timely intervention can prevent further deterioration in the patient's condition. MRI is the preferred modality here, as it provides clear images of blood collections, allowing clinicians to decide if surgical intervention is required. A fifth important area is the assessment of ligamentous injury. Ligament injuries can destabilize the spine, which increases the risk of spinal cord injury. MRI allows us to see these ligaments and detect any damage, which is often invisible on X-ray or CT scans. Identifying ligamentous injury early on can guide decisions about bracing or surgical stabilization to protect the spinal cord from additional harm. Lastly, MRI is useful for evaluating post-injury inflammation and edema. Inflammation after an injury can lead to swelling, which may compress the spinal cord and surrounding nerves. Swelling can exacerbate the severity of the initial injury if left unchecked. MRI helps in identifying any areas of swelling, which can then be managed with anti-inflammatory medications or other treatments as necessary. In summary, MRI plays an essential role in diagnosing various spinal cord injuries. While CT and X-ray are valuable initial tools, MRI provides the detailed imaging necessary to detect spinal cord compression, disc herniation, vertebral fractures, hematomas, ligamentous injuries, and inflammation. Understanding these diagnostic steps will help you make informed decisions about when MRI is necessary and how its findings can impact patient care.
Extract 2. Questions 37 to 42. You hear a conversation between a host and Dr. Norrin Spencer, a geneticist and researcher specializing in gene therapy approaches for blood disorders. Now, read the questions. You now have 90 seconds to read questions.
Welcome everyone to today's episode on groundbreaking developments in gene therapy for hemoglobinopathies. Today we have with us Dr. Norrin Spencer, a geneticist and researcher specializing in gene therapy approaches for blood disorders. Dr. Spencer, thank you for joining us.
Thank you for having me. It's an exciting time in the field, especially with the recent advances in gene therapy for conditions like sickle cell disease and thalassemia.
Could you start by explaining what hemoglobinopathies are and why these conditions are challenging to treat?
Absolutely. Hemoglobinopathies are genetic disorders affecting hemoglobin, the protein in red blood cells responsible for transporting oxygen. Two well-known types are sickle cell disease (SCD) and thalassemia. In SCD, a mutation causes hemoglobin molecules to become misshapen, which leads to issues like painful crises, anemia, and even organ damage. Thalassemia, on the other hand, causes reduced hemoglobin production, leading to severe anemia and related complications.
Why have traditional treatments for these conditions been limited in effectiveness?
Traditional treatments, like blood transfusions and medications, only address the symptoms rather than the root cause, which is the genetic mutation. For example, frequent blood transfusions are common in thalassemia, but can lead to iron overload, requiring chelation therapy to remove excess iron. Bone marrow transplants can offer a cure but come with high risks and are limited by donor availability. This is where gene therapy comes into play, as it targets the genetic source of the condition.
So, how does gene therapy work for conditions like SCD and thalassemia?
Gene therapy for hemoglobinopathies involves modifying the patient's own stem cells to produce normal or functional hemoglobin. There are two primary approaches. The first is gene addition, where a functional copy of the gene is introduced into the stem cells. The second approach, which is more recent, involves gene editing, using CRISPR technology to correct the specific mutation in the patient's DNA. After modifying these cells, they are reintroduced into the patient, where they ideally produce healthy red blood cells.
Can you share a specific case or example to illustrate how this therapy is applied?
Sure. Let's consider a hypothetical patient named Maria, a young adult with severe SCD. She experiences frequent pain crises and organ complications. Traditional therapies weren't enough to control her symptoms, so she was enrolled in a clinical trial for gene therapy. Doctors harvested her stem cells, used gene editing techniques to correct the mutation, and then infused the modified cells back into her bloodstream. Within 6 months, Maria reported fewer pain episodes, and her hemoglobin levels were stable.
That's remarkable. What are some challenges you've encountered in developing these gene therapies?
One major challenge is the potential for unintended genetic changes during gene editing, which could lead to other health risks. Another challenge is the accessibility of gene therapy. The procedures and equipment required are expensive and not widely available, especially in low-resource settings where these diseases are most prevalent.
What measures are being taken to address these challenges and make the therapies safer and more accessible?
Researchers are working on refining gene editing techniques to improve safety and precision. Clinical trials closely monitor patients for any side effects or adverse reactions. For accessibility, there's ongoing research into developing cost-effective methods for gene therapy that could be deployed more widely. Collaborative efforts are also underway to make these treatments available in countries heavily affected by SCD and thalassemia.
Do you believe gene therapy will become the standard treatment for hemoglobinopathies?
While it's too early to say it will completely replace traditional treatments, gene therapy shows strong potential to offer a one-time curative option. As research progresses, we might see these therapies become more widely available, especially as technology advances and costs potentially decrease.
Thank you, Dr. Spencer. This has been an incredibly enlightening discussion on the future of gene therapy for hemoglobinopathies.
Thank you, it's been a pleasure discussing this topic.
That is the end of Part C. You now have 2 minutes to check your answers.